Area that has received a lot of attention during this meeting is the use of bisphosphonates, particularly a drug called Zometa. Zometa is a drug that's used not only for osteoporosis, but it's also used in patients with bone metastases to lower the risk of bone complications. There has been some evidence for years that this class of drugs, when used in early stage breast cancer, may actually prevent a recurrence. But we don't know the mechanism. Maybe by slowing down bone turnover, it makes the bone a less hospitable place for metastases. But nevertheless, putting this to a test to see if we should be treating everybody with bisphosphonates has been a big priority. Several trials now have been completed and reported earlier, and generally did not show a clear benefit overall in the most recent trial reported, but an earlier trial that had looked at premenopausal women treated with blockage of ovarian function, so essentially putting them into menopause, did show a benefit. So there's been a lot of confusion as to whether bisphosphonates help or not. In Europe, for example, the uptake has been more. People are now routinely using it in the US as well. And there's been more data from this meeting to discern what's going on. And what appears to be emerging is that if you're premenopausal, and your ovaries are still making estrogen, that bisphosphonates don't seem to help. In fact, in some analyses, they may even make recurrences more frequent. But in postmenopausal women, either women that have gone through menopause naturally or who are receiving medications to suppress the ovaries, it does seem to benefit. Now, these are subset analyses. It's not the sort of thing that the FDA would approve. But the question is whether doctors are going to start using it ahead of the formal approval in postmenopausal patients. Again, physicians are going to vote with their feet. I think this is an area where you're going to see some discordance in what the standard of practice is.